Okay, welcome back from the break.
Thank you, sir. Welcome.
So,
So I wanted to ask a question before we proceeded on break.
it's okay.
All right.
Go ahead.
All right. My question is, what is the place of masturbation in the place of sexual disorders?
Masturbation is a maladaptive behavior.
Maladaptive.
Yes. It's a behavior that deviates from the normal way of thinking. It is actually not classified as a disorder. It's it is a behavior. It is mostly at times a behavior exhibited by people with low self-esteem because they have sexual desire, but they cannot channel their sexual desires appropriately. Maybe for feeling of low self-esteem, or for feeling that they might not be accepted by the opposite sex. They come to engage in behaviors that could reduce their sexual tension. Have I responded to you?
Yes, you have. You have. I'm just trying to juxtapose that if that is actually said not to be a sexual disorder, I'm just trying to juxtapose it with some other forms like fetishism, voyeurism, and others, which also seem to me as a maladaptive some kind of behavior. So I'm wondering why that will be singled out to say is actually not a disorder, but just maybe it occurs to people who have low self-esteem. For instance, if we talk about people with fetishism, it's unimaginable that somebody just want to have sexual attraction with non-living objects and something like that. So I'm just wondering.
That is why it's abnormal. It's not normal. That's why it's abnormal. That's why it's abnormal.
Right.
Now, you know, masturbation is a behavioral manifestation of an intent, isn't it?
Yeah.
So when you take a look at people who masturbate, or when you assess people who masturbate, they have sexual attraction to the opposite sex. For others, fear to express their sexual desires. For fear, one, for low self-esteem, two, for fear of refusal, may resort to ease their tension through masturbation. Now, immediately that tension is eased, they return to normal. When we talk about fetishism, it is a persistent and consistent sexual attraction to non-living objects or specific body parts. Persistent, consistent. I don't know if I have made that point clear.
Yes, you have. But let me add up another question again. Now,
Go ahead.
with the difference you just struck, consistent and repetitive action. Can one actually can one actually exhibit one or more of these aberrations or these disorders? Like somebody, is it possible for someone to be having attraction for non-living objects and at the same time maybe be a pedophilia?
Yes. Yes. It's possible. It's very possible. Are we together?
Yes, sir, we are. We are.
Okay. Okay,
Yes,
so
sir.
before we proceeded on break, we were looking at
Let's go to
Christopher.
Cheladi, mute your mic, please.
what I wanted to do, what I was doing when we were talking, you're having six.
Sorry, please.
Okay, there is a big part here. Yes. Yeah. Now, let's. There is a big part. What are the root causes? What are the root causes of?
Cheladi.
The last one, the very last question here.
Mute your mic.
What are the root causes? But let's take two. Let's take two. We will get to that one. We have identified this problem, right? These are the issues. So that question is, what are the root causes of this problem? Look at that star, very last one.
The host should mute everybody. The host should. The host is Masters, SS Masters Zoom.
Can we have it quiet, please, so that we can continue? Can we proceed?
Yes, Doc.
Okay, so before we proceeded
Let's proceed.
for our break, we were looking at causes of sexual disorders. And we were discussing psychological causes. And we said anxiety and stress is one of the causes. We discussed depression, trauma. We also spoke about relationship issues as well as body image. Now that we are back, we'll be looking at, we'll go over social and cultural causes, and we said there are high societal expectations. And these expectations, we call them unrealistic expectations around sex, performance, and body image. And we say that they are actually causes of sexual dysfunction and sexual disorders. I would say that generally, in times where we are now, there are actually unrealistic expectations around issues of sex that have triggered people of all ages into patronizing sex enhancers. You hardly go through the internet or you walk past the street without finding someone selling sex enhancers. These are actually present societal expectations about sex. Studies have actually shown that people who engage in such practices in order to meet societal expectations end up having erectile dysfunctions as they advance in age. And then we have cultural or religious beliefs, which has to do with restrictive or guilt-inducing beliefs around sex. Then you also notice there is lack of education or limited knowledge about sex, relationships, or even communication, which have actually been a contributory factor to sexual disorders. And there is this societal or social anxiety that has to do with fear of judgment, probably judgment of performance, rejection, or social evaluations. All this we have agreed that there are factors that contribute to the onset and development of sexual disorders. We have also considered other factors like aging and lifestyle. And we say that as men, as humans advance in age, there is naturally, we have hormonal changes that takes place. As a child advances in old age, there are hormonal changes. You remember when we discussed, we were trying to define the puberty. We say it is a developmental stage in life where a child begins to experience both physical and hormonal changes that are preparing him or her for adulthood. And there are hormonal changes that prepares one for adulthood, and there are hormonal changes that prepares one for aging. So in aging, hormonal changes also results to sexual dysfunction. They result to decreased libido, also physical function. So physical functions also affect sexual performance. So at that time, sexual dysfunctions begin to set in. Lifestyle has to do with poor diet, the type of food you eat. There are other food substances that when you eat may trigger replacement of lost cells or regeneration of dead cells. When you engage in poor diet, of course, it also affects, it results to sexual disorders or dysfunctions. We also talk about lack of exercise. Exercise is very key. It enhances sexual performance. But when you don't engage in exercise, it also to some extent results to dysfunction. We also have chronic stress, where we're discussing this. Other persons mentioned the issue of money, that when there is no money, stress sets in. Yes, stress sets in from for others, for their inability to have resources to meet their needs. They are stressed up psychologically. Others because of the activities, the number of activities they have engaged themselves in the course of the day. You also notice the experience stress. But by and large, chronic stress is also one of the common factors that also affects sexual performance and results to sexual disorders. So it's very important for us to recognize that sexual disorders often result from a combination of all these factors we have discussed here. It cannot be attributed to a single cause. Therefore, a comprehensive approach to diagnosis and treatment can help individuals address underlying issues that actually improve their sexual well-being. Are we together?
Yes, sir, we are together.
Yes, sir.
So we'll take a look at treatment. How do we treat sexual disorders? Our treatment of sexual disorders, just like every other disorder we have discussed, whether they are psychotic disorders, whether they are neurotic disorders, whether they are personality disorders, whether they are childhood disorders, whether they are emotional disorders, involves a combination of both medical, psychological, and lifestyle interventions. And this is also same for sexual disorders. And basically, common approaches begins with medical treatments, from medications. We have sildenafil, which is a phosphodiesterase inhibitors. This is for erectile dysfunction. For people who are having difficulty to have a strong erection, we have a hormonal therapy to correct hormonal imbalances, where assessments and laboratory investigations have shown that sexual disorders are rising from hormonal imbalances. And then we also have what is called the hormone replacement therapy, which is also a medical form of treatment for sexual disorders. Now, for people who have hormonal imbalances or hormonal deficiencies, they are placed on hormonal replacement therapy to boost, to perform the functions of hormones that hitherto are not actually performing, that have resulted to sexual dysfunctions. And then we have also what is called testosterone therapy for men, and that's for people who have low testosterone levels. They are placed under this therapy to boost their testosterone levels. You know, testosterone is a male hormone that that triggers sexual activities. So for men with low testosterone, they are placed on this therapy to boost their own testosterone level to have an active sexual life. Can we make progress, or there is a question for us to take at this point?
Let's make progress, sir.
Sir, yes, I think there is a question. Maybe I didn't pay attention very well, or I may be mistaken, but I have heard some practitioners, some medical experts at some point about presence of diseases like infections as some other causes of maybe erectile dysfunction. How true could that be within the context of our discussion?
Yes, infections can also affect, can result to sexual disorders. But that can happen at a chronic stage where they are untreated for a long duration. Now, when you go back to look at our discussion on types of sexual dysfunctions, we also had mentioned that one of them has to do with sexual aversion disorders. Most of the times, aversion comes from the fear of pains an individual experiences or will experience during sexual intercourse. So you also notice that such individuals who have chronic infections that results to pains during sex will be aversive completely about sexual activities. Have I responded to you?
Very well. Thank you, sir.
Okay. So we are also talking about psychological components of treatment of sexual dysfunctions. And we will not stop mentioning cognitive behavioral therapy. It's a therapy of choice because it has to do with an individual's thought pattern that results to obvious or overt behavioral characteristics. So it is also a therapy of choice here. And of particular note, we in CBT, we talk about thought restructuring. And CBT as a psychological treatment component helps individuals to identify and change negative thought patterns that have actually become a cause of sexual disorders. And then we have what is called sex therapy, addressing relationship and intimacy issues. And it helps, sex therapy helps improves communication between sexual partners. We also have another form of psychological treatment called the couples therapy. It works with both partners to improve relationship dynamics, even as they journey their sexual lives. And we have mindfulness-based therapies that help reduce stress and anxiety and improves emotion or emotional regulations in individuals whose emotions and stress have actually impinged on their sexual life. Are we together?
Yes, sir.
Can we make progress?
Excuse me, sir, please.
Yes.
Please, can you throw more light on this mindfulness-based therapies, please?
Okay.
I don't understand it.
Individuals experience stress. Every individual has experienced one form of stress or the other in the course of the day. And mindfulness as a form of therapy helps the individual to become focused, help the individual to become focused on areas of his life, that reduces stress. Now, when you say you must be mindful of what you are doing, what do you mean?
You don't need to do that one. Pay attention or be focused.
Hello?
It's being paying attention to what.
Hello, sir.
Yes.
You are conscious of what you are doing. You're conscious of your actions.
You are conscious of your actions. So individuals engages themselves every day in actions or inactions that increases or reduces their stress or increases their anxiety level. So mindfulness as a therapeutic approach helps you to be able to identify, or helps you to identify those stressors that ordinarily have been ignored. You have looked at them not as potential threats to your mental health. A stressful individual will have no interest in sex, isn't it?
Yes, sir.
Yes. So it helps you change negative thought patterns about stressors and develop more positive patterns or attitude or behavioral actions in mitigating the impact of stress on your life. And once this is done, there is an improvement, a corresponding improvement in your sex life or your sexual behavior. Are we together?
Yes, sir.
Have I answered you?
Yes, sir. Thank you, sir.
Okay.
Because I just, out of curiosity, within the context of this psychological therapy, in a scenario where a man feels less of sexual drive towards his wife, but is very hyperactive, maybe with a side chick or another woman entirely, so to say, and within the context of this, which of these that would be a better therapy in fixing problem? Would it be the cognitive behavioral therapy or the couples therapy?
Yes, both the cognitive sex and couples therapy will be good therapeutic approaches for such a one. Now, what happens in such scenario is a comprehensive assessment of the individual concerns, so that hidden or underlying issues that prompted his actions can be identified in order to be addressed. Now, when such issues are identified, the individual's thought pattern is reshaped through talk here to drop behaviors that are maladaptive and learn adaptive behaviors that can improve his relationship.
Thank you, sir. Thank you.
It's all right. Can we make progress?
Yes, sir.
So we have life changes, lifestyle changes. Lifestyle has to do with your pattern, your regular pattern of behavior. You have a regular pattern of behavior that has actually become a routine for you. It is called a lifestyle. Now, our lifestyles tend to affect every aspect of our behavior. And even for sexual disorders, in treating sexual disorders, lifestyles are very important to be modified in order to improve or in order to treat our disorders. And the first lifestyle to be changed is exercise and physical activity. Regular exercise can improve not just our sexual activities, but overall individual health and well-being. So as we engage in physical exercise, we can be able to make some changes in our sexual dysfunctions. Now, most of the times people feel that when you talk about regular exercise, people feel that you need to take a walk 1 kilometer, 2 kilometers down the road before you know you are doing an exercise, or you need to skip, you need to weight lift, or you need to go to the gym. No, there are exercises. These exercises can be done within the confines of your room. So one does not necessarily need to walk down the road, but within the confines of your room, you can also jog, you can also skip, you can also walk. Walking around the small space within your house is exercise enough to improve your overall health and well-being. Then we talk about healthy diet. I remember during our primary school days, we were taught what is called a balanced diet in health education. And our common definition, jokingly, of a balanced diet then was a man who balanced and died. There are 6 classes of food. It is expected that every meal of ours should be able to contain these 6 classes of food in the correct proportion. Why that is relatively very difficult? It is expected that an individual should be mindful of what he eats. Not every food is good for certain ages and for certain times. And healthy dieting also has to do with the timing of your eating behavior. Some persons have bad eating behavior that they can eat as late as 1 a.m. provided they are hungry. And all these help deteriorate our sex life, resulting to sexual dysfunctions, and even reduces our overall well-being. You will agree with me that healthy diets help manage chronic health conditions, be it diabetics, be it hypertension, be it cardiovascular disease like hypertensive heart failure or hypertensive heart disease, be it even cancers can best be managed with diet, and several other health conditions. So eating healthy diet, which is a lifestyle change, can also improve sex behavior. Studies have also shown that certain fruits like bananas, like watermelons, like cucumber, carrots, they have the potentials of boosting your sexual stamina when you are experiencing sexual dysfunctions. So we are encouraged. Gemga, we're encouraged to take healthy diets. Yes, Gemga, we're with you. Can you ask your questions or make your contribution?
Good afternoon, sir.
Good afternoon.
Sir, yes, sir. Concerning the eating habits, you did
Yes.
mention of there's some people that do eat in the 1 a.m. thereabout.
Yes.
What if the person is awake, like walking? Is it preferable for such people to eat at that hour Because I discovered that there are some people that do work all through night. Is it
every day?
Yes, sir.
Okay, for 30 days, they are working 30 days all through the night.
Yes, sir.
Okay.
So you should write the information.
Yes, staying awake. Of course, our normal body physiology works in such a way that our body works more at night when we sleep than when we are awake. Those who work awake all through the night can also take light foods, like taking a cup of tea with biscuits that can be able to digest before daybreak, or can be able to digest properly before daybreak. Eating late in the night results to constipation, what others call food poisoning.
Okay.
Are we together?
Yes, sir.
Yes, sir.
So eating very late in the night is not encouraged for our body system. Now, for people who eat fatty foods late in the night, this food, the breakdown process is not complete. The excessive fat are stored in the adipose tissue, and this cumulatively results to high blood pressure, diabetes, and several other health complications. Have I answered you?
Yes, sir. Thank you, sir.
Excuse me, sir.
Yes.
Sir, please, I want to ask, is sex making is part of exercise?
What?
Sex.
Yes, yes.
Hello?
Yeah.
Exercise is anything you do and sweat.
Hi.
Okay, yes.
Okay,
Hello, sir.
Are we together?
Who is making noise now?
Nyamji, can we have it together, please?
Hello, sir.
Please let the host mute everybody now.
No.
Are we together? Can we continue?
Yes, sir.
Yes, it's also dependent on how you look at it. It can also be considered a form of exercise.
Okay. Thank you, sir.
You're welcome. So we are also talking about stress management techniques like meditation, yoga, or deep breathing exercises. This help in correcting our dysfunction. Then we have communication.
Sir, you are the host. You can mute everybody. The noise is really distracting.
So lastly, we can talk about support sex education, other interventions like sex education, having proper knowledge about sex, we'll talk about communication, open and honest communication with partners. Are we together?
Yes, sir.
Yes, sir.
Open and honest communication with partners also improves sex. and also correct dysfunctions. And then sensate focus exercise. This helps individuals focus on sensations rather than performance. Finally, about treatment, there are also other interventions that have to do with sex education, educating individuals about sex, about relationship, and also how to communicate, as partners in a sexual act. Then we also have support groups for those who have challenges, that they have not been able to overcome. This category of persons can also find support groups that have to have similar focus of their own challenges. They can join these support groups. They can also find out from others how they were able to overcome their challenges, or how they were able to overcome experiences that posed a problem to their sexual life. And finally, we talk about couples intimacy exercise, building intimacy and connection. This has to do with building a strong relationship, strong body language communications that are peculiar to couples. This also, to a greater extent, addresses issues of sexual dysfunctions among individuals. Is there any question?
I want to believe that this support group must be a group with integrity, not a group that can expose somebody's problem.
Now, for every support group, the support group has aims and objectives that are geared towards addressing your own challenge. You don't go and form a support group of maybe people who go to gym, who don't have whose problems are not similar with yours, and you expect that support group to address your problems. Now, if you go to developed nations, there are a lot of support groups that help others who have similar constraints overcome them. Now, in general practices, if you go to developed nations, we have what we call the Alcohol Anonymous group. We have the stroke group. We have therapeutic groups, people who attend therapy that is addressing a common challenge. These people come into a support group. Their aim is to help one another come out of their challenges. Unlike here, we don't have much of these support groups, coming up or springing up where people's needs can be addressed as a group. Are we together?
Yes, sir, we're together.
You back.
So
you
on that note,
as a type of
Next week, we know it.
as a type of sexual types of sexual dysfunction, you mentioned paraphilic. I don't know how it came. So I would like you to
Also, no, give me
I mentioned what?
Okay.
Hello? Hello?
Hi.
Yes, someone was asking a question.
Yes, you mentioned as the classification or types of sexual this thing you mentioned paraphilic. I don't know how it come about there. Paraphilic, how it come there. I don't know whether as a type of sexual disorder.
Pedophilia.
Okay. Paraphilia or paraphilic disorder is an experience of reoccurring or intense sexual arousal of a typical object, places, situations, fantasies, or behaviors. Are we together?
Yes, doctor.
Have I responded to your question?
Okay. Hello, good afternoon, doctor.
Afternoon, Bushman.
Yes, please. I want to do a follow-up question
Okay.
in regards to what that sister asked. Now, in that kind of case, what treatment do you administer to such a person?
Which kind of case?
The one she just mentioned now, that which you just explained. And then I also wanted to find out in a situation where someone is having a sexual disorder like a pedophilia, what do you administer as treatment? Because the other ones you were talking about erectile dysfunction and all of that. So when someone's problem is targeting the young ones, what do you actually administer as treatment to help the person?
Okay, much of this treatments, some of these disorders require psychological interventions and other interventions like sex education. But for psychological interventions, the cognitive behavioral therapy is one key therapy intervening in people with phidiophiles. Now, they need a thought reorientation. Now, in CBT, there is a technique of CBT called thought restructuring. There are also other techniques such as the token economy. You can combine these techniques together to treat. But for phidiophiles, the CBT is actually a treatment of choice for phidiophiles.
Thank you, sir.
You're welcome.
Excuse me, sir.
Yes, Emma.
Sir, please, I want to really know, how does couples treat disorder? Because you were talking about body language. I'm beginning to wonder, how does body language treat disorder? So I really want to know, sir.
Okay. For instance, you have lost sexual interest.
Okay.
Somebody asked a question and was saying you have channeled your sexual interest to a side chick. Now, maybe one reason, one justification a man would give is that since I got married to my wife, he has stopped dressing to be sexually attractive, isn't it? Now, before now, there were also body languages that they spoke during courtship, sexual body languages. But when they got married, everybody relaxed. And interest
like what, sir? Would you mention one body language that actually treats
dressing sexy?
Is that a body language enough?
Dressing what?
Sexy.
Okay.
Smelling nice.
Very nice.
Okay.
Yes.
Nice.
Okay, we have the ladies in the
Always
house.
spicy.
Wait. Here, ladies in the house supposed to help Doc out.
Is it all about the ladies?
It's also about the men to tell us what they want.
They are the ones in charge of body language.
No, even men too.
Oh, is that so?
Don't have to be biased.
How about? I think as for the men, one of the body language is actually keeping caring. Actually, as the way you be caring to a lady, that's it's very obvious that this person has intention, just and then once the ladies fall first, it's actually body language. It's actually being cared for.
Apart from being careful, touching, you can touch your woman, touch your man.
Hello, doctor. Please, can I come in, sir?
Okay, yes.
Okay, sir. You see, thank you, sir. I think it's the general thing I'm saying. Most men need education, sir. Most men don't understand they don't understand the psychology and the build of women. A man just believe that I don't know. Can you hear me, sir? Can you hear me?
We're hearing you.
Okay, thank you, sir. Now, when it comes to sex, sex is an act that involves two individuals. So I believe that for you to have a success at it, we need the two people to be genuinely involved. That means everybody needs a certain kind of education. The women need to understand how a man moves from a rosa to having sex to the final point. Same thing with a woman. Now, the body of a woman is not necessarily a tool for sex, just as we can say the same of men. But if you understand that there are certain things that helps to arouse women and there are certain things that helps to arouse men, you know, it will help more. Now, when we are talking about the women should dress well on a
The doc,
balance.
hold on.
Sorry.
I think Doc's network threw him out. You should hold on.
Okay.
We
Okay,
not
sir.
we know the same learning process. Her explanation is helping even with the student. How should
But
he hold on?
He needs to
The one learning. We are the one learning.
No, just allow the dog needs to be around. Just as an observation, just allow.
The class lecturer is providing the answer. So if he has been logged up, then we need to wait a bit.
Okay, so I should hold on.
Yes, ma'am, you should hold on for a moment.
Okay.
Because when he comes back, he will ask you to go all over again. So let's wait. Meanwhile, after the lecture, there's an important announcement. So let's wait for it.
I try this code for another one. What to make a no surprise me? Another one.
Mr. Teso.
First rep, I think he just dropped a message.
Okay, I went checking him.
He said that the network is bad, so he will take Doshiman's questions tomorrow.
Okay, I've seen that. So guys, there are some few announcements here. It would be nice if I drop it here. And then okay, so we need to choose our electives. I think we are supposed to pick 2 electives. So they are not forcing anybody to pick an elective. You're supposed to choose the one that
I'm not hearing.
maybe. Hello, can you hear me now?
Yes.
Yeah, we're hearing you, Mr. Fan.
Okay, so we need to pick the courses that resonate with what you want to use your your sustainable development experience after here. I don't know that you understand. So picking those electives will help shape where you are heading to. So it's not about where a particular person is choosing. You should choose the one that resonates with you. That's it. And then the second one will be our group assignment. Initially, I said we should vote so that let it not be as if there wasn't a consensus before we accepted on the way the group was done. However, most of us didn't vote. But these things, they have implications when you cannot back it up with evidence that it was a whole class that accepted that, okay, the grouping is fine for them. That's why I was telling us to vote for it. So if you are not part of a group, apart from the people that had initially indicated, if you are hearing me and you are not part of any group, then please, you need to chat me up. Put it on the group rather. put it on a group so that I will know that you are not on any of the group. Then I will fix you up.
Okay. Taking.
Okay.
Like Tete,
Now,
Emmanuel, who again? Is it Emmanuel? There's another person that chatted me. I have like 2 persons, and then of recent 2 people were added to the WhatsApp group. So please, if they can hear me, they should chat on the WhatsApp group that they don't have a group. They are not being placed in any subgroup, so that I will do it, because I will want to forward those names to today. Then
sorry.
Mr. Dr. Oga gave his note, and inside his note, there are 2 assignments. He has requested that we should do those assignments too. I will chat him up to know the date we're supposed to submit them. Mr. Ali has also told me this morning that he will send his slides over the weekend.
Sorry for cutting you short. I didn't get the part you said about Dr. Oga.
There are assignments in his facilitation slides.
Okay.
So he
Alright.
has asked those assignments. So I will get back to him to know how we're supposed to submit them.
Okay. I thought you said Dr. Oga's assignment with the other person, we should combine them together.
I didn't say that, sir.
Really? I thought, okay. It's okay.
Pastor, for those of us that were not grouped, if we ask you then how are we getting our group? Pastor, for those of us that were not grouped in that first assignment, like my name is Tete Emmanuel. So how do we get the group?
I mentioned earlier that for you and someone else that chatted me, I can't recall the name immediately. I know that there are 2 people who are pending, but this is just after I sent it to after I sent it to Dr. Remember our SDGs, leaving no one behind. But then if we delay on this and then I send it, then whoever wants to be placed in a group will have to interact with him.
Okay. It's all right. All right, but
So,
hello.
That is,
so
that means what you are saying is method of hello, sir. Hello,
yes,
sir.
Sir.
Okay. I say what you are saying right now is that means SST 805 advanced research method for social standard. We are submitting 2 different assignments, isn't it?
Yes, sir. That's
Sorry,
it.
I can't hear you. Okay.
Yes,
okay.
sir.
Okay.
That's it.
Okay. 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 We'll make an arrangement for Dr. August on
Yes,
different, and then do the other person's on different too.
I will get that and get back
I
to
see.
you.
Thank you.
So please.
Cosref.
Okay,
Yes,
thank
sir.
you, sir.
Cosref. Yeah, we have to remind them that the 2 lecturers that give 2 assessments is on different and separate pages of doing them. They should not go and combine them on one line.
I thought I answered that. Mr.
No,
Inalibu asked, and
it's them, it's our mates, I'm telling them. Some they will say that one lecturer gave 2 assessments, then they will do it on one sheet.
Okay.
It's different, separate. You understand?
I understand.
Let me ask you carelessly,
Yes.
are those ones separately given, will they be submitted online as well? They will be submitted by hands?
I think he has to instruct the course rep, then he will revert to us.
It's okay, so no problem. No
So to
problem.
Anis,
During that time, talk.
Hello, sir. Hello, sir. Cosrep, Fayam. Hello.
yes,
Fayam, some of us are having difficulty with the network. It's blinking. We are not getting you. We are getting you halfway. So if you can put it on our student platform as you normally do, so that we can also you will be carried along, because the network is just cutting. I'm not getting what you are telling us.
Yes, that is important. I would say that you still put it on the page so that it will be clear at the sign of it.
yes, I only had the opportunity. I needed to do it here too, because there are some people who for whatever reason don't want to be on that other group, so we can't force them. So
No,
I
you are
needed
doing
to.
it. It's the right thing you are doing. But I'm only also observing, because the network were not clear. It will go off, then for some time it will come back. So that is difficult. That is why I made that suggestion.
So I'm doing that. I'm doing that, and then because of that, I don't want people to miss the announcement. I'm locking the WhatsApp group after I drop those announcements. You'll be able
Okay.
to read
Thank you.
what is there.
Mr. Taku, good afternoon.
Good afternoon, sir.
We're in the same group, group 7.
Yes.
All right. So admin, host can end the meeting.
Host is SS Masters do.
I will have to call him.
Class rep, can we log out now?
Yes, you
Yes,
can.
you can.
All right.
You can.
Thank you.
Sorry, cost rep. Okay, he has gone.
You say you give months, right? 500. Yeah, why back at 350? We'll give you change.
The chairman, John, are you still there? Hello.